today I'm going to be sharing with you my understanding of health. Not that my understanding is very different from the classical definition of health, but I believe that by thinking differently and by seeing things differently, it offers one an opportunity to explore things that you ordinarily will not see. To be sure that I'm talking within the books, health for me is a complete physical, mental, social, and emotional well-being, and not merely the absence of disease or infirmity. This is how classically we're all taught in medical school a couple of decades ago. Now, if this is health, it's not just absence of disease. It is complete physical, mental well-being. What are we talking about? What is so different about health? But before I talk to you, I want to share with you a story that happened just yesterday. A profound story for me as an obstetrician-gynecologist. But a sad story because it was not reported in the newspapers, as profound as my story is. Yesterday there was a plane crash. And on this plane, there were 110 pregnant women. Some have one baby, some have two babies. All of them died. No single person survived. It happened yesterday in Nigeria. And it was not reported in the newspapers. I can see the pain, and I can see the disbelief. But this is exactly the number of women that die every single day in Nigeria because of pregnancy and childbirth, and we don't talk about it. This is the number of women that died yesterday. As we're talking, half of them have already died today, and the rest will certainly die before close of business today. And so it happens day in, day out. This is my life as an obstetrician. This is what we see. Maternal health is the one indicator that is being used to measure the health of any nation. So for me, where do we stand as a country? Where does Nigeria stand as a country in terms of maternal health? Now, in health, if you look at Nigeria, the giant of Africa, we stand tall even in maternal death. Our maternal mortality ratio is about 576. But the 576 is just a number per 100,000 births. If you look very, very closely, for you to understand, you have to look very closely at the data. And this is our own national survey. If you look at the data, there is a significant difference between the North and the South. The data on the right is that of the Northwest, and on the extreme left is the South-South. Under 5 mortality is the top blue one. And look at how high it is in the Northwest, Northeast, and Southeast. And then it goes down this way. And this is so consistent. In fact, if you look very closely at maternal mortality ratio, which is the real indicator that is used for monitoring and assessing the development of any country, you look at it, the Southwest has I'd say to you 576, isn't it? But the Southwest has a maternal mortality ratio of 165. And where I come from, we have a maternal mortality ratio of over 1,500. In the Northwest, over 1,000, 1,025. So what is this game? Is it that there aren't enough hospitals? If you look at the system of Nigeria, because we are a federation, every tertiary institution has to be spread equally to fit the geopolitical zone. So there are numbers there, you find governments there, almost everything that's done centrally, there's some level of equity in terms of numbers. What is crucial in maternal mortality is not just the death of a woman. When a woman dies in any family, what really happens is that she goes away, a lot of times with an unborn child. All her living children become orphans, and the husband becomes wifeless. Imagine a scenario where a family you know, and I want you to look at it very, very personal. Look back to your own village. We all come from a different village. Probably few of us are from Abuja. In your own village, an aunt you know, a cousin you know. Among the women in Nigeria, any woman who bothers to be pregnant at this stage stands a 1 in 30 risk of dying. So if this was a bunch of women, we probably have this number dying in 9 months. Why is this important? Why is maternal mortality ratio important? But also importantly, why is there a significant difference between the Southwest and the Northeast and the Northwest? Is that because these ones, all their children are nyaninya, and therefore they're just selling granules and stuff, and the husbands are malams, and therefore, which is, I learned, is a synonym for security guard? Is it because of their ethnicity? Is it because of their religion, or is it because of their culture? Or even is it because of their wealth quintile? Unfortunately, it's none of these. It's not genetic, it's not cultural, it's not religion. Then what is it? What is that notorious thing that is giving this figure? If you look even further, the key is actually the level of education of the women. This is the central denominator that determines the level of maternal health. In fact, the level of education of a woman is much more significant than wealth quintile. If you compare the level of education of a woman and the wealth of a family, level of education is much more important. It is important because it is only with completion of secondary school that knowledge is transferred from knowledge in the brain, sitting in the brain, to action. I remember we did a study somewhere in Jigawa State where knowledge of women for family planning was as high as 75%, but less than 1% use family planning. And this is simple. You need to get a level of knowledge that is so significant that you can move from knowing to acting. And this is what completion of secondary school does. Also, what we found is that completion of secondary school has a multiplier effect on life itself. It reduces maternal mortality. It reduces child mortality. The chances of a child dying, of a mother that has not gone through school, compared to that has gone through secondary school, is twice. And when you take it to tertiary school, tertiary institution, it's 3 times less likely to die if a woman has tertiary institution, and half if the woman has secondary school education. But also importantly, women that have secondary school education, the data has consistently shown us from 1999 to date that women who have secondary school education are better able, first, they marry later. On average, the average age of marriage among women with no education is 13, and first childbirth is 15. So just by going through the motion of completing secondary school, even if you got all the Fs and you didn't learn anything, just being there in school moves your age of marriage from about 13 to about 19, and age of first childbirth to about 20 years. And for me as an obstetrician, what is important is that a couple of things. One, I know for certain that the woman's pelvis continues to grow until the age of 20. So therefore, a girl below the age of 20 is a parasite, is a growing child. And to have a baby that is a parasite living in her, competing for her nutrients, competing for the calcium she needs to grow her bones, competing for the iron she needs to grow her blood, competing for the protein that she needs to grow up to be a woman, is a parasitic relationship. So therefore, if a girl's pelvis does not grow to its natural size, which happens around the age of 19, you find that she's not even able, after carrying a baby for 9 months, she's not able to successfully deliver the child, unless the child is severely malnourished, which then increases the chances of the child's death. So a girl just keeping her in school with learning nothing, increases her probability of survival, increases the probability of her child's survival, and it gives her an opportunity for her to also grow. But also importantly, it also allows her, when she does marry, to be able to take decisions around pregnancy, attend antenatal, deliver in facility, immunize her children. A lot of the children that die in Nigeria die of preventable diseases. They're not dying of cancer, they're not dying of leukemia, they're not dying of any fantastic disease that's not preventable. A lot of our children die of measles. I'm sure you've heard the recent outbreak of measles that is shamefully happening in this country. A lot of them die of meningitis. A lot of them die of pneumonia and diarrhea. These are all preventable things that can be prevented cheaply. This is what happens when a baby gives birth to a baby. This is what happens when a girl does not reach maturity and she starts the process of childbirth. But also very, very important is the fact that childbirth now, I know, at least I have many children, requires more than just the biology. It requires ability to guide the child. It requires ability to be able to know what kinds of things, what kinds of chat is your child going through on the phone. It requires an ability to understand the social media, the social context that the child is living. So if we do not take care of maternal mortality, what really happens then is that a lot of children grow up with ignorant moms. And you can imagine in this digital age, you saw what Sadiq told us, what everybody showed us. Can you imagine a child being brought up first without a mother, without guidance, without love, without emotional stability, and you just take that child and put that child in a world to compete with the Sadiqs? What opportunity are you giving that child? Now for me, as a health person, because health is not just simply the absence of disease or infirmity, it's a complete physical, mental, and emotional well-being. What is key for us here? So what's the big deal? Why are we talking about this? What does it concern me? After all, I'm healthy, my children are healthy, my grandchildren, I hope, will be healthy. What the big deal here is that health is not just about you. Health is about social and emotional well-being. And because it involves social and emotional well-being, my health is dependent on the health of so many people. The health of your neighbor will impact on your health. The health of your cousin will impact on your health. The health of your co-worker will impact on your health. And so therefore, thinking about health in a broad sense is not just being good. It's not being altruistic. It's actually being selfish. How do I live longer life without stress? And you can only do this if you care about the health of your neighbor. But most importantly, the health of women and children. Now, the health of women and children is no big deal. It's just ensuring that women and girls are well educated. If you educate a girl, she will figure out the rest. She will definitely figure out the rest. But when I think, every time I think and have the opportunity to talk to young people, I always go back to one thing, that in order for us to be impactful, we have to begin to change our paradigm of thinking. At the moment, we are in a gear, a fast gear of, I'm okay. If I am okay, everything is okay. But it's not okay if only you are okay. And I'll tell you why. At the moment, about half of Nigerian children don't finish secondary school. In this day and age, a lot of you will excel. A lot of those children will not excel. They will be your houseboy, housegirl drivers. Your life will be totally dependent on them. Can you imagine a life where your houseboy, your housegirl, your driver, and your cleaner gang up against you? That's death without a coffin. So for me, the issue of health is not just health, it's an issue of social justice and social inequity. We cannot continue to stay and be happy that I can go to any hospital I want to go to, and that my sister next door could just die. The one thing I can assure you would happen is that if I do allow that, the children of my sister will make life impossible for me, or make life impossible for my children or my children's children. So it's not okay that you are okay. And I think for me, if you get out of this, and in the few minutes I speak, you only go out with one thing. It's not okay when I alone is okay. It's only okay when we are all okay, because social justice and equity is not acceptable. Importantly, I also know that you each one of you, it doesn't matter your age, including Fauzia, you can do something. You don't have to have money. You don't need to send me proposals. You don't have to have money to do something. You just need two things. One, a frame of mind, a changed frame of mind that is not okay when I'm okay. That I have a responsibility to ensure that every other person within my little niche is also okay. This for me is social justice and the basis of life itself. The second is you can do something. So for me, if we sit here and discuss intellectually and go out, honestly, we have failed and we have wasted our day. It's not okay to have intellectual discussion. It's not okay to chat. It's not okay to just SMS and tweet. What is okay is when you do something about it. And you can do something about it. You can take your mouth and talk about it. You can ensure in your little environment that every girl goes to school. You can ensure in your own little environment that you're doing what you need to do. You don't need money. So my hope and prayer is that as we walk out here, we'll also give ourselves permission to just stop and think. This is the one gift we all have and we don't use. Just stop and think. For heaven's sake, don't tweet for 1 hour. Just think, reflect on the day, and come up with one little thing that you can do to change somebody else's life. For me, that is health. For me, that is social justice. For me, that is equity. And for me, importantly, this is the only way that we can move this country forward. And trust me, you can't rely on people my age. We haven't done it. We're not going to do it in the last 2 decades of our age, of our lives. The ball is in your court. You can do it. You're the future of this country. I thank you all.